As you can see, I'm settling nicely into my first location for season 2. This is Helsinki in Finland. And for the next month or so, I'm going to be traveling across Europe and exploring how this region is battling with two opposing ideals. The first one being is, how do you deal with a prevailing pandemic? And in some countries, a resurgent one. And the second being, how do you inject life into a weary economy and get beyond COVID, if indeed there is such a thing? But before I start this next chapter, I wanted to share an interview with an important guest that I spoke with just a few weeks ago as I was wrapping season 1. This individual was at the helm of GE Healthcare during the pandemic. His name is Kieran Murphy. He's the CEO and president. And here's what he had to say.
Kieran, look, I've got 20 years in the military under my belt, many tours of duty. So I've got a good sense of what it's like to lead in a crisis situation. You're the man at the top of the pyramid. You're the CEO. What have been the obstacles and challenges that you've had to face during this pandemic?
We deal with the safety issue. We deal with the economics of the situation, and we deal with the external forces. And I don't need to tell you, given your military experience, reading that situation is really important. Just reading the situation we're in is absolutely critical. And then applying the right brains to that problem. It's not over yet, but it was an experience I wouldn't swap for anything. It was actually, at one level, terrifying, but also quite exciting.
As you rightly pointed out, Kieran, we're not out of the woods yet. But how does today, looking back, how has COVID-19 affected the company and healthcare? And then maybe we can just talk about looking into the future, how that might evolve even further.
For the industry, I think we all have a brand new appreciation for people that work on the front line. Looking every night at nurses working long shifts in full PPE gear, and the risk people took, I think that's changed mindsets of a lot of people, actually. I think it'll change the whole dynamic, by the way, in healthcare of the relationship between critical care, what needs to happen in a hospital, and how we deal with the care homes and social care. And so as I start to think about all that dynamic, the way in which we think about our role in monitoring, for example, we're primarily focused on ICU today, but I think the opportunity for the future becomes looking at the whole patient journey. We look at that workflow in command center today, but I think the monitoring of patients becomes a much broader task. And there's no question that the safety of transfer of patients within a hospital, out of a hospital, that's going to change a lot.
There's two schools of thought. Some people talk about going back to the old days, back to normal. And then some people, I personally have a view on, will never be the same as what we were. From your perspective, is there anything that won't ever be the same when it comes to healthcare after COVID-19?
Well, I spoke to one of the hospital CEOs from the US a couple of weeks ago here, and he said, listen, we probably made about 8 years progress digitally in the last 2 months. And things that they'd been trying to achieve within the hospital and within radiology, every single development went on steroids. And so all of a sudden, teleradiology became a complete necessity. Remote everything became a necessity. And that's a permanent change. And the use of digital technology has just ramped up dramatically. And we know that from even the way the two of us are meeting now. But think about that in relation to the way patients go for a consultation with a medical doctor in the future. It's going to be completely different. And more and more, the interaction is going to be like the one that you and I are having now, that's going to lead to an initial diagnosis. And when we think about that, it's a very much more efficient and very safe way to practice, actually. Now, there's always the danger that gets overdone, but at the same time, this is a permanent change.
Many of your employees, many of your customers will be watching this. So what's your message to them?
I think for our customers, thank you for your support. Thank you for sticking with us. Our customers trusted us to do a lot of things through all of this. And, we're all in this together for the long term. And I really like the fact that people reached out to GE kind of as a default, because they knew we had the scale and we had the right people with the right mindset to help out. I just want to pay huge respect to the 50,000 people that work in GE Healthcare. Just to see an army march with the right attitude, the incredible passion, understanding of our purpose and our role in all of this has been really very heartening, actually. And it's amazing how people made sacrifices. And it's we just have to be incredibly grateful for that. We'll never be able to repay some of it, actually. So I think it's been really happening. And I think it's very important also for us to understand that we will survive this. We get to the other side. We didn't change our strategy. We didn't change our priorities in life, actually, in terms of the quality of our products, the way we try to serve customers. We maintained a lot of momentum behind our innovation. In fact, we speeded it up in many places. We did great collaborations with people like Ford and Microsoft. And it's very important that we remember to maintain those muscles, actually, and maybe keep some of that incredible camaraderie and horizontal work that made us successful during COVID-19. We have to maintain that post-COVID-19. But I'm extremely grateful to everybody. I'm very proud. I just want to say thank you.
As the man at the top of the pyramid, as the person with the 30,000-foot perspective, it's an incredibly important aspect of the storytelling that we've been doing. So thank you very much, Kieran. Appreciate it.